Sandra Sace was diagnosed with skin cancer 10 years ago. By 2005, the melanoma had spread to her liver, lungs and spleen. Faced with a terminal illness, Sandra, who's 48, agreed to trial a new cancer drug, ipilimumab, and the results were startling. The drug, she says, saved her life.
There's no doubt about it. You know, I've been here for nearly 6 years longer than I should have been. You know, if I hadn't have had that drug, it's as simple as that. You know, there was no alternative at that point.
The main cause of melanoma is overexposure to the sun. Ipilimumab is the first drug in 30 years to have increased survival rates, and in the US, oncologists have hailed it as a landmark. But here, health watchdog NICE, the National Institute for Health and Clinical Excellence, will announce today that the NHS shouldn't fund it, as the drug's not cost-effective. A course of ipilimumab costs around £80,000 per patient, but NICE say studies show the drug only improves survival rates in around a third of patients, with just 10% gaining long-term benefit. But cancer charities say it's the cost of the drug, not its use, that needs reviewing.
The main thing is that there needs to be some discussion between the manufacturers and the Department of Health to see whether the price can be adjusted in some way to make it better value for money.
2,000 people a year in the UK die from skin cancer. Despite still living with the disease, Sandra is looking forward. NICE are due to make a final decision on the use of ipilimumab in a few months' time, a drug Sandra firmly believes stopped her becoming a statistic. Simon Newton, Sky News, West London.